Like, I'll give you an example. Somebody falls down, they get a bad bruise. And the reason you get a bad bruise is because the small blood vessels get burst and you bleed. And that's where you got that. And then nature heals that area by absorbing those blood cells and making new tissues there. And the same thing we are doing, that when we're injecting it, we're trying to make body think that, look, the injury has happened, and body tries to repair it, and body finds those concentrated platelets and concentrated growth factors to achieve that.
Brilliant. So the work that's done at Awesome and the treatment pathways offered, it stays very clear from, as you say, any moral ethical issues. You use your own fat.
And we don't use anyone else's fat. We don't use anybody else's cell. We use the patient's cell, and we would offer it. We'll discuss it with the patient. If the patient doesn't want to have it done, that's absolutely fine. The old standard treatment has been giving steroid injection, then we can certainly give a steroid injection. And then there are other options, like where, again, we try to replicate the body's own healing potential by using extracorporeal shockwave therapy, which we do not have at Awesome, but when I was doing my clinics in London and in Milton Keynes and in Jersey Channel Islands, when I was living and working there, I had my own extracorporeal shockwave machine, which is again the same principle, that it tries to create a little bit of bleed so that those cells go there, they release those growth factors and try to heal.